Hello viewers, it's Dr. Mashhood with another video on Dr. Mashhood Emergency Medicine YouTube channel. Today we're going to talk about hyperthyroidism. The reason hyperthyroidism is important is because most of the patients do suffer with symptoms of hyperthyroidism for a very long time without knowing they have hyperthyroidism. The symptoms I'm talking about are symptoms such as anxiety, insomnia, or palpitations. These are the three most common signs and symptoms of hyperthyroidism, and most of the people in the general public tend to experience these symptoms for a very long time because they've not been diagnosed properly, because they've been not investigated properly, hence they cannot get the right treatment. Hence the importance of the topic of hyperthyroidism. In simple terms, if we talk about what is hyperthyroidism, when we break down the word, hyper means too much and thyroidism means a thyroid hormone. So hyperthyroidism in essence means when there's too much thyroid hormone in the blood. The release of the thyroid hormone is very simple. When hypothalamus in the brain receives signals that the thyroid hormones are too low in the blood streams, it starts secreting a hormone called thyrotropin releasing hormone. This thyrotropin releasing hormone then goes and activates the anterior pituitary gland, which is again situated in the brain. And then when the anterior pituitary gland receives this response, it secretes the thyroid stimulating hormone. And this is where things get interesting. The thyroid stimulating hormone, or the TSH, then goes and works on the thyroid gland, which are two glands situated in the front of the neck. And the TSH causes the thyroid gland, which is made up of thousands of small cells called follicles. The TSH causes those follicles to start producing thyroid hormones in the form of T3 and T4. So among all these pathophysiology, the most important things to remember is the hypothalamus, which releases thyrotropin releasing hormone, the anterior pituitary gland, which releases the thyroid stimulating hormone, and the thyroid gland, which on the orders of the TSH releases the T3 and T4. So when the thyroid hormones T3 and T4 gets released into the bloodstream, they tend to bind with proteins, and the proteins acts as the carrier of these thyroid hormones T3 and T4, and then they transport these thyroid hormones throughout the cells. The main function of the thyroid hormones, which are T3 and T4, is to increase the basal metabolic rate, or the basal metabolism of the cells. When the T4 reaches the cells, it gets broken down into T3, or it gets converted into T3. And T3 is the hormone which actually is responsible for the increase of the basal metabolism. Now, there are two main causes of hyperthyroidism, and these are primarily divided into two types, the primary and the secondary. The two most important causes of primary hyperthyroidism is the Graves' disease and toxic nodular goiter. The Graves' disease is an autoimmune disorder in which the B cells starts producing autoantibodies against the thyroid gland, and these autoantibodies mimic the TSH, and when they bind to the follicles in the thyroid gland, it produces increased amounts of T3 and T4. So it works essentially in the same way. So it's stimulating the thyroid gland to produce more and more thyroid hormones. Hence the levels of T3 and T4 increase dramatically in the blood, and it causes all the symptoms we're going to talk about in a little while. The second most important cause of primary hyperthyroidism is what we call as the toxic nodular goiter. In toxic nodular goiter, there's mutated TSH, which causes again increased levels of T3 and T4, and this mutated TSH stimulates the follicles to produce more thyroid hormones. There are several important secondary causes of hyperthyroidism. There could be a TSH secreting adenoma, which probably is one of the most common causes of secondary hyperthyroidism. The other causes are when the thyroid gland gets inflamed or swelled up in a condition called thyroiditis. It again is one of the causes of secondary hyperthyroidism. It releases increased levels of T3 and T4. Iodine-induced thyroiditis, iodine-induced thyrotoxicosis is another cause of secondary hyperthyroidism. And the last one is the hyperfunctioning thyroid adenoma. So two more important causes of primary hyperthyroidism are Graves' disease and toxic nodular goiter, and the four important causes of secondary hyperthyroidism would be TSH secreting adenoma, thyroiditis, iodine-induced thyrotoxicosis, and hyperfunctioning thyroid adenoma. Now let's talk about the signs and symptoms. The most common ones, which we mentioned at the start of the video, are anxiety. A person who has high levels of thyroid hormones will have high levels of anxiety because the cells are producing so much energy, or their basal metabolic rate is so high that causes patients to be anxious all the time. Then insomnia or lack of sleep. Because cells are producing so much energy, it doesn't allow the brain cells to settle down because they're full of energy, and so it's very difficult to sleep in the night, and patients develop insomnia or inability to sleep, which can last for multiple days. The third most important one is palpitations. Now this is a sign and symptom which does normally come on and off. And if somebody is experiencing palpitations for, let's say, a couple of days, it would be important to check their thyroid levels just to make sure they're not having any of the causes of hyperthyroidism. Weight loss. Weight loss in the context of an increased appetite, which essentially means that the person's eating has increased his appetite, but they're still noticing, instead of gaining weight, they start losing weight. They lose weight because of the fact that the cells are utilizing whatever they're eating, the calories, and burning it off, and because the metabolic rate is so high, so all those calories, all those food items they eat, they get burned off, all the calories gets used up, and that produces increased amount of energy, which essentially is causing any of these symptoms such as palpitations, insomnia, anxiety, weight loss. Some people do experience hyperactivity, which is quite obvious. If somebody has high levels of energy because of increased basal metabolic rate, they will become hyperactive. And some patients experience that they have increased amount of sweating, which is also commonly seen in hyperthyroidism. So the question really is diagnosis. The diagnosis is made if any of these symptoms are present, or if there is a family history of hyperthyroidism. It's essential that three things are done. The TSH levels are looked at, including as well as the T3 and T4 levels. So three things we need to look at: the TSH, T3, and T4. So let's presume T3 and T4 levels are high, then they will make us suspicious that my patient might have hyperthyroidism. In that case, your physician might request you to have a radioactive iodine uptake scan, which essentially looks at how likely or how much is the thyroid gland using up your iodine. Now, this treatment is essentially based on what symptoms patients is having. If they're having a lot of palpitations, then your physician might start you on some beta blockers, or beta blockers are also used in sometimes in controlling anxiety symptoms. So beta blockers could be used as a symptomatic control, but if there are increased levels of thyroid hormones, then anti-thyroid drugs will be used, which blocks the usage of thyroid gland, blocks the usage of thyroid hormones within the cells. So anti-thyroid drugs, beta blockers, and sometimes they do radioiodine therapy, as to get to the bottom of the cause of thyroid secretion and to resolve the problem. And the last but not the least is thyroid gland removal. So just to summarize, the physician can start you on some beta blockers. They can start you on some anti-thyroid drugs to counteract the effects of T3 and T4. Radioactive iodine therapy could be used, and in one of the other measures is the thyroid gland removal. So in summary, it's very important to find out if somebody is suffering from hyperthyroidism by doing a very simple test such as TSH, T3 and T4. Signs symptoms such as anxiety, insomnia, palpitations and weight loss, in spite of having a very good or high appetite, should make one suspicious of hyperthyroidism. Similarly, our topic to hypothyroidism, which we did a couple of weeks ago and which is uploaded on the channel, hyperthyroidism is also one of the important causes to bear in mind. If you have any questions or comments, please mention in the comments below. The whole description of what we discussed today I've mentioned in the description below the video. I hope you like this topic. I will come back with a new topic in next week. Thank you very much.